Hi, welcome to another Uplift Start of the week, the place where we discuss things that are relevant to Jewish women, to us, to anybody who wants to join. This week, we're celebrating Hanukkah, and tonight's actually the first night of Hanukkah, Sunday. And what happens in a world where everyone is celebrating and getting all excited about Hanukkah, and there's all these parties going on by everybody's house, and you are faced with a child or yourself or anyone, it really could be anyone, who has a problem with food. They could be an overeater, they could be an undereater. There's just a problem. What happens to that? Today, I'm bringing in a really great person who will give us a lot of knowledge on this very subject, and her name is Marcy Forta. Am I pronouncing it right, Marcy?
Yes.
Okay, Marcy is the founder and director of Atzmi, a leading authority on eating disorders within the Jewish adolescent community, but her knowledge is just so vast in nutrition and in every way. She appeared in one of our previous magazines, and I just thought that without her knowledge on this, subject, how do you go into something like Hanukkah? So first and foremost, thank you for joining me. And
thank you for asking me. Thank you.
Just tell us where you're from.
I'm actually from Michigan, United States, Michigan. Yeah, born and bred, been here all my life.
Wow.
Yeah.
So maybe tell us a little bit of the history. How did you get involved in, this? Is there a personal thing that brought you to it?
I actually owned and ran a women and girls sneakers clothing store here in Michigan for over 15 years. And it always struck me when, we had clothes for young girls and for young women, and women, when girls were changing bodies, they were becoming young girls to young women. It was very stressful for them. They found it very difficult to be comfortable in their bodies and to dress their bodies. And mothers were stressed in trying to help their daughters with that comfort level, but also young mothers were very stressed and distressed as well. After they would have a baby, they would apologize that they didn't get back to their pre-baby weight or their shape. A lot of distress about getting dressed and being in our bodies. When I sold the store, it really had a huge effect on me. And the truth of the matter is I personally had struggled with an eating disorder when I was a teen. And so I knew the struggle very intimately. And I wanted to figure out how could I help before it becomes an eating disorder is always the hope. I mean, that would be ideal. So that's when I went back to school to kind of study eating disorders. What are the unique risk factors in our community? What are the struggles that we have? And then, of course, how do we prevent those? So that's what the programs I've developed help girls kind of have a better body image, develop that self-compassion, defocus on outward appearances, while also helping them determine their boundaries, their priorities. How do they deal with these emotions around their physical bodies and how they feel about themselves? And how do we establish some healthy relationships? So we've created these programs to help pretty much with everyone's mental health, because it's a struggle we all know and we all have at some point.
Yeah. Do you think it's a struggle that's an inherited struggle, or is it a struggle that's, each time comes up differently?
You're saying for each person, or?
Yeah, each person. I mean, today, when people are doing, is it something that's an inherited thing, meaning that it's passed down and it's just a struggle that goes on and on and on? That's what I feel about it. But
yes, it's very cultural, environmental.
That's what I meant. I'm sorry. Yeah, it's a cultural inherited thing.
No, yes. I mean, so eating disorders, of course, and disordered eating or struggles with our bodies are not the same levels. We all have some level of struggle to some extent because we have a lot of stress on our outward appearance, right? So, I mean, it's definitely a struggle. I would say that most people have. The numbers show that 75 to 80% of adolescent girls have some dissatisfaction with their bodies. And I don't think it's that different for women either. We've all grown up in the same fishbowl, I like to call it, because we all come from the same culture. We have the same expectations. The struggles are different, but we all struggle with it at one point or another. I would say the vast majority of us, definitely.
Right. I mean, so how are you, I mean, in the schools, I know you have a whole new system that you're bringing into the schools. I think that we should get that into the conversation because I think that's so important to know about. I wish we could bring it here to England because I think it's fabulous. So let's hear
We
about
can. I mean, the way we've created the curriculum is we have curriculum for 8th, 10th, and 12th grade girls, which I know is going to be a little different in England how the grades work. But it's just 4 sessions for each grade, and we train teachers in the school or social workers or mental health professionals in the school to actually give those interventions. And we're working on, obviously, scientifically kind of just making sure that we're reinforcing those values and those messages that we'd like for the girls. But we also, part of the program is we also talk to the parents and the teachers as well, because we've all grown up with the same issues as well. So I want them to understand, how do we create our daughter's body image? What goes into that? And where do those thoughts come from? And then how do we change the conversation? And how do we feel better about some of these messages we've gotten ourselves, so that our daughters, who are the mothers of the next generation, can raise their daughters, with different ways to talk to them about their bodies and different ways to feel about that. And then, of course, in schools, there still is some weight stigma, some messages that get passed on. And it's really important for teachers to understand signs and symptoms of eating disorders, but also how do we model some of these behaviors unintentionally? Parents, it's all unintentional. No one wants to give their daughters a bad feeling. Sometimes truly mothers are just trying to help their daughters not go through maybe what they experienced, but they don't realize how some of those messages can be so harmful to them and can ultimately cause stresses and struggles. So it's anyone who's kind of a part of how a girl's body image is created needs to also kind of be informed as to what goes into that. So we do, like I said, the schools themselves implement the curriculum. Oftentimes I'm the one who gives the talk for the teachers and for the parents, but that can be done via Zoom or in person. I do it both ways. And it's, Baruch Hashem, we found it to be really helpful when the parents have an understanding of what's going on with the girls and how they can change how they talk to them. They've been very open to it right away, because every mother just wants what's best for her daughter.
100%. And are you, I mean, I know that you're trying to stop the problem from even starting, but are you also dealing with children who are in the already, in that place that they're starting to have these problems?
So I do a lot of support for parents. I don't treat eating disorders. That's not something that I do. I usually provide a lot of parental support, just direction. Where do we go from here? Can I help you find a provider that can help your daughter? What kinds of support might she need? Usually when someone has an eating disorder, it's not one therapist that's going to be enough. You need a team of people to help. So you need a physical health provider, like a doctor. You need a mental health provider, oftentimes a dietitian. There are recovery coaches. It's usually a team. And oftentimes the parent doesn't know, what is my role in my daughter's or son's recovery? What is it that I need to provide? How responsible am I? And it's really hard sometimes, because people who are in the throes of an eating disorder generally are also struggling cognitively, because when you are depleted of nourishment, especially during adolescent years, the research shows that can be very difficult, because there's a cognitive impairment. So they might not be understanding things in the way, they might not be acting like the child that you know that they are. And that will change. When they're gotten the treatment that they need and they're getting better, that will change. But the struggle of the eating disorder voice and some of the messages and the internal struggle that they're going through can be really hard for a parent. So I do a lot of support with the parents. I don't work directly with children.
Wow, that's so interesting to know. So let's say somebody who's listening to this does have a child who's in the throes of this type of behavior. Is there anything that they could do through Zoom? Let's say, could they meet you through Zoom? Because I know that you work in New York, and in America, but we're talking to people all over the world, and I want everyone to feel that there's something that they could do. So, is there something?
Absolutely. I speak to people all over the world. That's the truth. Okay. Sometimes it's via Zoom, sometimes it's just a phone call, and sometimes I did support groups for a while. I don't have one at the moment, but there are other organizations, mask support groups. There's a Rabbi Tzvi Steinberg in Lakewood, who does a lot of support. Also, so there's a lot of support out there. I am working on an organization. It's in its very preliminary stages, but most of the parents that I speak to, because there's a lot of shame and stigma around eating disorders. As a matter of fact, someone just told me, this breaks my heart, a story of a couple who has, the wife has a very severe eating disorder, and they were able to have one child, but they haven't been able to have another child. And the husband tells people that their wife has cancer. That's why they can't have more children, because he's so embarrassed of the fact that she has an eating disorder. So there's a ton of stigma around eating disorders. And so when a child is diagnosed or someone's diagnosed, there's not a lot of places that they can go to get information. What can I expect? What is going to happen? When someone's diagnosed, chas v'shalom, with other illnesses, usually there's a protocol and there's a lot out there for
you're
them.
right. Any kind of illness that has a name to it, like, God forbid, cancer, leukemia, when we're talking about stomachs, we could go into what's that? Crohn's. There are protocols. You're right.
And so these mothers that I've spoken to, parents, fathers too, feel very alone right away, because they just don't feel that they know even what to expect. What is their child going through mentally? What's happening? It's almost like they want not a welcome packet, but kind of a protocol of, also, what is my role? They're not a therapist, but they have to help with certain things. So there are a lot of pieces and questions that they have. And a lot of parents find comfort in being paired with another parent. Either one going through it right now, or somebody who's been through it where their child's on the other end of it, and so they can kind of see the light at the end of the tunnel. So pairing parents up is huge. Helping them kind of with that, what can I expect? Because there are so many types of eating disorders too. Sometimes they might get a diagnosis that they weren't familiar with and they didn't see it coming, or they didn't realize. They know that their child had anxiety or depression, but they didn't realize the extent, or that it accompanied the eating disorder. Or how do I approach this issue with my child when they also have an eating disorder? All these are real issues that they have. So I am trying to work on an organization that will help support parents through this, because they need a lot of support.
I think this, talking about it in these little forums, and I know you've spoken to lots of different people. I met Marcy through LinkedIn. So I know that Marcy really talks about this a lot. And I think that's the most important thing, is just to get out, to talk about these things, and forget the stigma, because we can stigmatize everything. Someone said to me once, oh, if somebody knows this and this, then my child won't get married. I said, your child won't get married because they'll have a name of being a meshugana. You might as well say, this is it. And then we dealt with it. We took care of it. Look, we're on the other side. Don't stigmatize. And because you're stigmatizing yourself, put yourself in a corner that you can't get out of. It's easier to get out of something if you work with it. That's my personal view on these stuff.
Well, I so appreciate that you bring these to light. You do a lot of issues, and you highlight a lot of issues, which is so important. I think just talking about them makes a difference. And I also tell parents, for eating disorders, there's a lot of genetic predisposition, meaning it's like Crohn's or diabetes. If you have a genetic predisposition to an illness and something triggers that to come, then it's not a child's fault that this happens. It's something that is genetically encoded with how we're doing. And so that can also remove some of the stigma and shame around it, because it's not their fault that this happened. There's no constructive purpose and blame anyway. In other words, there's no blame for a parent, there's no blame for a child. How are we going to prevent this? And then if we get in this situation, then how are we going to help support our child to best get out of this situation? There are so many factors in every single eating disorder. There's no, because you did A, B, and C, therefore this happened with your daughter. No, that's not how it works at all. Every disorder is a whole world. And
100%. We kid ourselves by saying it's not true, but it is. It's 100% true. I see this with everything that we talk about. Everything is, there's so many triggers in our surrounding of who we are. We're a very close-knit community. We are into each other's pockets. We do have certain things we want our children to achieve. So there are certain things that we do without even realizing it. And I'm so glad that there is hope that will change this. We need to change all these stories, because this is the generation, in my view anyway, this is a generation for change. We have Zoom, we have such technology, which we always say, oh, it's terrible, but we have such great technology today that we could use and utilize to help
100%.
the next generation. So that's very important. I think it's very important that today, in this discussion, when we're discussing the Hanukkah issue, which is, in my view, that a child or an adult, it doesn't make a difference really who, sits down by a table and they're having their donuts and their latkes that are all filled with nice oil. I think I always say the oil is here and the latke is there. How do we, as parents who are giving the message to the next generation, how do we stop ourselves from making the mistake of saying, oh, too much, it's too much, I'm getting fat. These are natural things that we do, but that we do have to put a bit of a hold on. So what would you say?
I mean, number one, I would say we have to change the conversation around food. Food is fuel, right? It's nourishment, it sustains us, we need it several times a day, each and every day. It's a bracha from Hashem. We use it, in every way, especially in the Frum community. We use it for love, and our meals together are part of how we celebrate, connect, and how we observe our mitzvahs. So it's really important that I don't like when people judge food as healthy or unhealthy or good or bad, or people as good or bad because they ate this food or they did this thing. When you put judgment around food, then you're really stigmatizing it, and you are making it very difficult for your child to understand what its use is. We want to not moralize food. We oftentimes even use food as a reinforcement of behavior. So we create this unhealthy relationship with food with our children. And that's, the reality is that sometimes we're in the mood for this food and sometimes we're in the mood for that food. We have to learn to recognize our hunger cues and what nourishes us and what feels good for us. So on Hanukkah, when I want to eat a donut, that's what's nourishing to me at this moment. That's what is joyful for me at this moment. Do I want to eat 10 donuts every day for the rest of my life? No. And if I did, I wouldn't feel very good. But if I can recognize that my body feels better when I nourish it in a certain way, but that might mean donuts on Hanukkah for me, and that's perfectly fine. And that makes me happy, and that connects me with my children, and that connects me with the holidays, and there's nothing wrong with that. I think we have to look at things from a lens of self-compassion. So the idea of self-compassion is kind of threefold. We have to realize we have to have kind of self-kindness when we approach things, right? Being imperfect is part of who we are. Hashem didn't create us perfect, and that's okay. We're not meant to be perfect. We're always going to struggle with
the angels, wouldn't we?
Right, exactly. So, I might want to eat more than is good for me, but that's just a struggle that I have, and that's okay. When we can kind of better accept this reality, then we treat ourselves with self-kindness. So that's the first component, self-kindness versus self-judgment. The second concept of self-compassion is the idea of common humanity versus isolation. So the idea is that we all have different struggles, right? So my struggle might be food today, but it might be something else tomorrow. And we all struggle at different points in our lives, and that doesn't make me better or worse than anybody else. It just means I'm human. This is something we all share. We all have struggles. Once we realize that we are all struggling at some point, it kind of takes the stigma away from it, because we realize that, hey, I'm not the only one experiencing this. So that kind of lets us step back. And then, of course, that idea of mindfulness versus over-identification. I can observe these negative thoughts that I have. I might feel, hey, I'm overdoing the issue, but I don't have to get caught up. I talk to people about this idea of tornado of negative emotions. Sometimes we get stuck in it. Like you said, we're going to say, oh, I'm horrible. I ate 3 donuts. I'm a horrible person. I way overate. I always do this. I'm disgusting. They get caught up in this tornado. But if you can kind of step back from there and say, sure, today I might have eaten more than I wanted to eat. I enjoyed it. Tomorrow might be a different day. We don't get caught up in that negativity around what's going on with us today. It makes it much more doable for us to kind of approach how we do things. And Hanukkah is a time of joy. We are meant to enjoy the food. We're meant to enjoy the dairy and the oil, and it's not a year-round thing. There's nothing wrong with enjoying it.
I think it's so important that we get that across, because I'll tell you, it's a very funny thing, actually. I have always had a weight issue, which is fine. I mean, I've gotten over it. I have gotten over it. I haven't gotten over it. That's besides the point. But I remember I recently had been diagnosed with diabetes, and it was like a very quick, I ended up in the hospital, the whole business. And I actually turned the whole thing around. I went away from it, but I had to stop eating sugar. And it was like a real turnaround for me that all of a sudden for health reason, I wasn't allowed to have sugar, because all the other years I was able, I always found it very hard to put away sugar. But when it became a health issue, it was like a matter of life or death. I put away sugar.
Yeah.
But even in the hospital, they said, when it comes to having a sugar, and you eat it, she goes, get on with your life. Have your sugar, enjoy your sugar, and then get on with your life. She goes, you're not going to fall apart from 1 tablespoon of sugar. But I think that's really important. The same thing. We think that this one donut is going to make us fat. That's not the truth. It isn't the truth. It's not. It's when you, like you say, when you overboard anything. That's
when you ask for something or make it like you can't have it, it's horrible, then you want it more. And that's when it becomes an issue for you and your kids. So many people will tell me, we're not allowed to have this food in our home. And I tell them, that's your prerogative and that's your right as a parent. But I'm just telling you that your child is going to eat it somewhere else. Because when you make it as something that they can't have, they want it more.
They want it.
But when you allow them to have choices and feel, how does this feel in your body? Does this feel good? Do you want this today? When you allow them to have some choices, and of course, age appropriate choices. You can't tell a 5-year-old they can eat whatever they want, whenever they want. If that's not exactly. I had a story of somebody who contacted me. Her daughter has asthma. So she decided that she wanted to help her with the asthma via her diet versus medication. And that was fine. That was her choice as a parent. The daughter was 11, but she started stealing food in school. The principal called that she's stealing food out of the kids' lunches. She wanted that food, but her mother wouldn't let her have it. It was a very, significant kind of dietary restriction that she had. And she's like, and I feel really bad because now she's stealing food from people. So we talked about it, and the mother, just wanted to help her daughter. She wasn't doing it to be mean. She didn't want her to have to take the medication. So her and her daughter had a conversation. I said, maybe give her some control back over her food. What kind of things can she have? Within 3 weeks of her letting her daughter make some choices, she had to go on a little bit of medication, but her daughter stopped and she felt so much better. When we give our kids some control, when we don't make it about having to be so controlled about everything we eat, they don't need to eat it as much anymore. They feel more comfortable around it. People who aren't allowed to have ice cream, and then they just eat it wherever they go. So many mothers tell me they allow anything in their home, so their daughter's friends come in and eat and eat and eat the whole time, because in their house they're not allowed to have it. But
I think that's the thing. We've put so many issues about what we're not allowed to do in every way. It's not only food; it's in everything. We're putting so many rules and regulations because I think that maybe we have so little control of our outside life that we trying to control this here, which is fine up to a point.
It's hard. We all struggle with it. There's no judgment. We all struggle with it in one way or another. But I've heard stories of women who were put on Weight Watchers when they were 6 years old, and it's always been a struggle for them. Our weight is determined by way more than what we eat.
I'll tell you something. It's funny that you're saying that. I went to my first visit in Weight Watchers when I was really 11 years old, very, very young. And I always say that my mother was actually really skinny. She was really skinny. She had a big mishigas with her weight. And it was something else. I always say there's always a background. And the background is what we have to really deal with. And that's where you're coming in, Marcy, that you're explaining that it's the background. We have to deal with the problems. It's not so much how we're controlling it, it's why we are controlling it.
And how can we change the conversations around things to make them less difficult, because we all struggle with these things. There's no doubt about it. And our weight is part of our life. It's genetic. It has to do with stressors, your life stage. It could be hormonal. It could be puberty. It could be medications that you're taking. It could be illnesses that you have. There are so many factors. People think it's all about what I eat and what I don't eat, but that's not. So many people eat hardly anything, and yet they can't lose weight.
And have problems, 100%.
100%. So we just kind of need to step back from it. It's hard. It's really, really hard because this is how we're programmed. Like you said, this is our culture. This is our environment. But when we can kind of step back from it and see it for what it is, that's when it makes the change. And it makes a big difference for our daughters who struggle with the same thing. And I'm not saying our sons don't. It's just that where I am right now is with our daughters.
Yeah, I think that's, we have to make that clear, because a lot of people, I mean, afterwards they say to us, well, why didn't you discuss men in our community? I'm here as a woman to woman magazine, and I invited Marcy in that, capacity. And I'm sure you have a lot of information on that too. But here we're discussing girls and the mothers, and that's the road that we're taking today. But I think before we're getting to the end of this, but I would like to just ask you if you could give some light to the end of this tunnel, because I think that Hanukkah is all about the light, and I think that that's what women, I think everyone needs, that some light to the end of the tunnel of, oh gosh, we'll never get our children out of this. How will we go further? And that's where I'd love you to do something on that.
I mean, the first thing I love to say is that we all, women and mothers, are just working to help their children. I believe, and what I've seen time and time again, is as soon as they become aware of where their daughter's body images might be coming from, or things that they might be saying or doing that might model certain behaviors, they want to change it. That is their first thing that they want to do, and they want to also feel free from it as well. I believe, that Jewish from people, we have the ability to do anything we want. Once you talk about something, you raise awareness about it, you understand it better, then that's when you can actually dispel it. When we have shame or guilt around our bodies or around what we eat, secrecy breeds shame, right? So when you can talk about it, know your triggers, when you can be open and honest about it with your daughter, when you can tell her your struggles and say, I want things to be different for you, or I'm struggling with this, but I'm working this way. Being honest with our kids and modeling that we're not perfect and we're not meant to be perfect, that's one of the greatest gifts that we can give them. We all just want to be great role models, and we are. I just think knowing this makes a huge difference. I've seen huge differences in families. Mothers are amazing. I think
that's so important to say that, and I'm glad you did, because I think
they love their kids. Yeah,
we always look at what we're not good at. We're fabulous. I mean, to live in today's generation, we are absolutely fabulous.
100%.
Yeah, so I think that's really important. I think that's a really fabulous way to come to the end of this. But Marcy, I want you to please I have all your information. I will put it all on the bottom of the podcast, and if anyone wants to get in touch with Marcy, please do so. She's fabulous. She has really good information, and thank you so much for coming, and I hope you have a lot of hatzlacha with everything, and I hope the light of Hanukkah, whether it's in your stomach or outside, we all get to have a lot of light of the Chag with us. Have a great great day. Thank you very much for joining me.
You too. Thank you for all you do.
Bye.